Are you worried that your child has autism but not sure how the diagnosis process goes? How can you be sure that your child is getting all the necessary tests? Well, most pediatricians do autism screenings, but very few perform additional tests that rule out other symptoms and conditions that may mimic autism. In this video, I'll go over the typical tests of autism that most doctors do and what most doctors don't do, and that you would really need for an accurate diagnosis of autism. Hi everyone, I'm Dr. Eileen Shi, a board-certified pediatrician. I work holistically with parents who want a child-centered approach to solve their children's health issues. So if that sounds like you, make sure to subscribe to the channel for more content just like this. Most pediatric clinics don't perform all the tests for autism, and here's why. Pediatricians are trained to screen for autism between 18 months to 36 months of age. And most clinics do this by using screening surveys, which ask the parents subjective feedback on what their child does at home most of the time. Screening tests are not designed to be diagnostic. They are, in essence, used to screen for children who may be at risk for autism or other developmental delays. The goal of screening is to find the ones that may be problematic and then refer out these families for further assessment. Let's talk a bit more about what symptoms you might expect to see in a child who may be autistic. It is important to note that even though a child may exhibit some or most of these symptoms, it still doesn't mean that the child absolutely necessarily have autism, as there are many conditions that mimic autism, as we will discuss a bit later. Children with ASD or autism spectrum disorder have impairments in two major domains. Number one is social communication and interaction, as in delayed speech, limited use of gestures, odd sounds or tone of voice, limited or little eye contact, along with limited gestures and verbal cues, difficulty with reciprocal conversations, little or no pretending or imitation of other people, and limited sharing of enjoyment with others. Two, restricted repetitive behavior, as in unusual hand, finger, or body movements, having fixation on specific objects or topics, and rituals of lining objects up, and or repeating things over and over, difficulty with changes in routine, and unusual sensory interests. While many clinicians and parents can pick up these behaviors in children and discuss that these behaviors may indicate autism, most pediatricians do not perform the full range of testing that helps to rule out other competing conditions, like ruling out limited speech and gestures due to hearing and visual impairments, intellectual delays, anxiety, attention deficit hyperactivity disorder or ADHD, food intolerances or nutritional imbalances, and gut dysbiosis. And that is the disconnect. Children with any of these conditions can similarly show behaviors that we see in children with ASD. By the way, if you found this video helpful, please give it a like and subscribe to the channel so that you will be notified of future content just like this. So why doesn't your pediatrician do these additional tests to narrow down the diagnosis? Well, it comes down to time and resources. Comprehensive testings like hearing, vision, cognitive delays, gut health, and autism require an extensive amount of time for collecting data, interpretation, and synthesis of the information to provide parents with a personalized recommendation of care. Many pediatricians also shy away from these testings and opt to focus on primary care concerns like ear infections and sore throats. But as you can imagine, a child with nutritional imbalances or chronic constipation can also have restricted food intake and behavioral changes and difficulty sleeping and other discomforts that affect his or her behavior. Also, you can imagine a child with hearing difficulty or intellectual disability can have difficulty communicating with words and sounds. So in order to make the right diagnosis, we must probe deeper and perform more testing. At our Las Vegas-based practice, we work with families one-on-one, offering concierge, individualized care to each patient holistically. We do what most pediatric practices won't do because we invest time in working with each family to treat the root cause. For families who are concerned about autism, we conduct an in-depth interview with the family and child to get a full medical history and social history from birth to current age. This allows us to have a clear understanding of any illness and stressors in the early childhood years that could have contributed to the neural development of the child. Secondly, we review the child's nutrition status, diet, personality, hobbies, and interests with the family. After a full physical exam, we sit down with the family to discuss the recommended testings that will help us determine the nature of the parent's concern. This may entail hearing and vision testing, blood work, tests for gut health, and based on each child's unique situation, we may recommend additional tests like cognitive and adaptive skills, intelligence, ADHD, and ADOS for autism. This allows the family and child to experience a full and comprehensive evaluation tailored to the child to closely pinpoint which areas of health are the most problematic. We perform most of the neurodevelopmental tests in person in the clinic, including standardized tests that evaluate and rule out competing diagnoses so that you and your family can be sure of the diagnosis. After the comprehensive interview and evaluation process, you will receive a complete personalized treatment plan that is one of its kind and state-of-the-art, complete with a holistic panel of treatments from targeted diet, lifestyle modifications, gut microbiome optimization, as well as a variety of therapies that would help your child thrive. Our goal, as is yours, is to offer the most holistic and compassionate comprehensive care to children with behavioral conditions that need multifaceted therapies and approach to wellness. We also believe in getting you in with less wait time and review the results with you within 3 weeks after your evaluation is complete. If that sounds good and you would like to learn more, visit our website at littlerootspeds.com. To learn more about how you can work with us, click on Become a Member and fill out the information so that we can schedule a time to chat. Thank you all for watching. See you next time as we navigate the world of holistic pediatric medicine.